All right, Doc, I am 71 years young right now. When I turned 50, I started getting my yearly physical, and that was a normal part of the physical pay, was getting a digital prostate exam. There was a period of time between the ages of 63 and 66 where I didn't have insurance and didn't get a yearly exam. Then at 66, I went in for my yearly physical. There was no digital prostate exam. I asked the doctor about that, and they said that was no longer done, that they just went with a PSA. I'm on my third doctor now, and that seems to be the norm. What do you think, doctor? You may want to answer this question. Well, I'm glad you asked this question because I think so many people are having this question because doctors don't want to check the prostate anymore. But why is that? So here's what I want you to do. If you really want to do a little extra research on this, you can really find a great article on this on uptodate.com. So this is what we as physicians use when we're trying to figure out, well, what are the up-to-date recommendations? And the cool thing about up-to-date is sometimes you don't have to have a subscription and you can read through it yourself. But it's a really long, very clinical response. But really, what it boils down to for screening for prostate cancer is that prostate cancer screening, because we assume as physicians that if you live long enough, if you live into 90 and you live into your 80s, you're going to develop in some way, shape, or form, some small part of prostate cancer. And that's we consider that to be kind of normal. We watch your prostate grow in size through the years, and we have considered that to just be a normal part of life and aging. So then what happens is, and one of the main reasons I am such a huge advocate of the digital rectal exam is because I know that prostate enlargement can wreak havoc on erections. But also when I was in residency, I happened to be working at a prison. Oops. Can you hear me? Yeah. I happened to be working at a prison, and I worked at a prison. I've done prison medicine for a really long time. I found out that my dad's grandfather was in prison. And he has got this great story he used to tell me about how he only met him once, and it was right after he got out of prison. And I think about the story now, and I often wonder if he had escaped from prison or if he had actually been let go. But so prisoners have always been a close place in my heart. So I remember I was working at a prison, and I went to do this guy's digital rectal exam. And the minute I put my finger into his rectum to check his prostate, it was clear to me, 100% clear, that he had prostate cancer. I didn't need a PSA. I didn't need any of that. So I've always felt like, ever since that piece, that when guys come in for their physical exam, I've always felt like I was cheating if I didn't do a digital rectal exam. You can find out so much from touching a patient's prostate. You can figure out if it's inflamed. You can figure out if it's enlarged. But I think when you read through why they've decided to make it so that a digital rectal exam isn't part of prostate cancer screening, is they say, well, you're only really touching the posterior part and the lateral side of it. So there's other parts of the prostate that you could miss if you're doing a digital rectal exam. So they advocate that prostate cancer screening is a decision that you make with your doctor, whether or not this is something that you should do. And it's really kind of only recommended every 2 years. So here's my problem with that. When we go and look at the data, and I'm going to share my screen with you again, they talk about, because really, honestly, when you go get screened for anything, the purpose is you screen for it. And if you find something that might be a little abnormal, now we got to do something about it, right? So with a PSA, one of the big issues with PSA, and the reason it's so controversial, is because you could go out and have sex today, get it in like for 2 or 3 hours, and then go in tomorrow. And because you had sexual activity, your PSA may be elevated. Your PSA may be elevated if you have prostatitis or your prostate is inflamed. Your PSA could be elevated after a motorcycle run. So many things can cause an elevation of PSA, because PSA stands for prostatic specific antigen. And really what the PSA was designed to do is, our bodies are designed, to procreate if you want to, right? So what the PSA's job is to do is to kind of help sperm fertilize, right? That's kind of what it's made to do. And so what we're doing when we are checking PSA levels, the prostatic specific antigen, is we're not taking into account that so many things can actually impact whether or not that PSA is elevated. Even exercise, even a heavy workout, even going for a vigorous jog could interfere with your prostate specific antigen. So what they've decided is they're like, yeah, okay, well, the PSA may not be the best screening tool, but it's the best one that they've gotten. So when you really look a little further and you start to look at what they're saying about the digital rectal exam, I kind of want to share it with you because I want you to kind of understand why practicing medicine can be so frustrating. Is they really talk about methods not generally used for screening. Now, the digital rectal exam used to be part of the screening process, but they've decided, we don't really need to do that. And in my opinion, it's pretty similar to saying, you know, for breast cancer screening, we really don't need to touch the breast at all. Let's just draw some labs. All right. So for me, it's been pretty frustrating. But I would like to point out here, if when you look at this part and you go to it yourself, it says, although digital rectal exam and PSA are somewhat complementary and their combined use may increase the overall rate of cancer detection, right? So they're basically saying, although if you use them together, we can detect cancers better than if we don't use them together. Digital rectal exam has limited utility as an adjunctive test. And they go on to talk about this multi-center screening study of 6,600 men. And the prostate detection rate was 3.2% for digital rectal exam, so just doing that. 4.6% for just doing the PSA. But look at this. This is my favorite part of this. And 5.8% for the two methods combined. So what they're saying is it's very clear that if we do a digital rectal exam along with the prostate specific antigen, that we would detect more. But we don't like the digital rectal exam. Nobody likes to do it. The patients don't like it. The doctors don't want to do it. So let's just cut it out. No, who knows why all of this is taken out. But I think it's very interesting to note that the two together give us a better outcome than just either or, right? And I also venture to say that it's really interesting when you read this because they even talk about the fact that, where was this? Oh, okay. So they said it's a low sensitivity test. Is due in part to the fact that the digital rectal exam only detects palpable abnormalities, things that you can feel, in the posterior and the lateral aspects of the prostate gland. Well, now when we're talking about erectile function, if you remember correctly, what's happening lateral or to the sides of the prostate gland is so important when it comes to erectile function. So how can you even think to help somebody with their erectile function if you're not going to even check their prostate, right? And then they say, although this is where the majority of cancers arise from, the part that we can feel and that we can touch, other areas of the prostate where cancer occurs are not reachable by a finger examination. So here, we'll get this blood test, and then what we'll do is if it's high, we're going to go take you to imaging, and then we'll probably do a biopsy. I just have a problem with that. I feel like a lot of guys go through and get biopsies unnecessarily without them doing the basics first. So I'm not a surgeon. I've never wanted to be a surgeon, and I will hold any surgeon to the fire that decides to not do the basic stuff before they go to operate, because I do recognize that doctors are like anybody else. They've got to make a living. All right. So very nice.